Hi, I'm Reed Holson. Welcome to Sioux Falls Directions. This is when we sit down and have conversations with one of the 12 directors of the City of Sioux Falls. And today we welcome Jill Franken, who's the director of the Public Health Department for the City of Sioux Falls. Welcome, Jill.
Hi.
Talk about the Public Health Department. It's a big department, lots of divisions, and lots of impact here in the City of Sioux Falls. So help us understand what you do.
Sure, absolutely. Well, the Health Department really is in charge of really protecting and promoting the health of the City of Sioux Falls. And so we kind of do that in a couple different ways. We have two large divisions within the Health Department. One is really to focus on the environmental aspects of our community and making sure that we live in a community that is healthy from a safety perspective. So like things like neighborhood nuisance issues, that the neighborhoods are clean and kept up to code, if you will. We assure that we have all the right safety mechanisms when you go out to a restaurant or to go to the grocery store to purchase your food. We do all those types of restaurant inspections, keep communicable diseases, foodborne illnesses as low as possible. And then we also look at the city as a whole to say, you know, how healthy is Sioux Falls and how can we make it the healthiest city possible? So our work through Live Well Sioux Falls would be another aspect of what we do in that area. Really looking at how people eat, how they move, how they feel, how they breathe. All those things are what we are really trying to promote and make the city as healthy as possible. The other side of the piece, and it's really from a budget and people perspective, the largest of the work we do, and that is our clinical services. Falls Community Health is our clinical services for the most part, and we provide a significant amount of primary care for people in the community. Anyone can be a patient of Falls Community Health, but we have we have grant funding through the federal grant to be able to provide to people who are uninsured and perhaps have an issue with access to primary care. And so about 50% of our 13,000 patients we serve are uninsured and come to our clinic. But then we have a variety of all others who come. They might have insurance, they might have Medicare, they might have Medicaid, and we provide their primary care. We also provide dental services to our patients, and so we have a number of dentists that provide those services for our patients. We have mental health services right on site. We have a specific group of staff who really are specialized in homeless health care services. We have folks that very specialize in HIV care to patients with HIV. We have folks who are specialized in doing sexually transmitted disease testing and educating people on that. And then we also are becoming very specialized in school-based healthcare. And we have 3 school-based sites that we provide services to children in those schools, so at Hayward, Hawthorne, and Terry Redland Elementary, and then to the families in the neighborhood as well. Anyone can come to those clinics also.
It sounds like you've responded to a lot of different change here in the Sioux Falls area because we've grown so exponentially and we've become more diverse. How has that affected the services you offer?
Probably the way it's affected them most was really us looking at how do we consider Sioux Falls. Like I always say, I like to think of Sioux Falls as my patient and how healthy is my patient. And that's something that communities are taking a serious look at is, do we have all the elements in place so that people can live, work, play here in this town and have it be as healthy as possible. And so the work we've done with Live Well Sioux Falls has been some of the newest work we've done lately to really assure that. And as we become part of a larger urban community, we are starting to compare ourselves with other urban communities around the country and what are they doing that's starting to see some good results? And how can we perhaps replicate that? Or where is there a gap in best practice and maybe we create that best practice for urban communities? So that's an area we've really gotten more involved in. There's always also when you get to be a larger community and you see changes in neighborhoods, you also can see where if there's some economic stressors that then lead to perhaps inability to perhaps care for your property the way you need to have it be healthy and safe, not only for themselves but for others. And so that's something that we're always working on as well.
Is it pretty unique for a municipality to have a public health department as comprehensive as ours is?
It's unique in, there's a couple uniquenesses there. It is unique in South Dakota. South Dakota has a much more centralized structure of public health. So the State Department of Health really helps assure those services to the rest of South Dakota. So that's a uniqueness. We might be somewhat unique for the size of our where we are as an urban center or urban community, but there are a lot of other departments of health that are in municipalities, just not in South Dakota necessarily. But what makes us really unique is that we run a community health center. That is a very specific, well, there are only about 5% or less of health centers across the country that are run by a public entity or a health department, for example. And so that puts us in a unique category, but a good category to be in because it's pretty well respected when you are running a public entity health center. Everybody wants to know what you're doing and how you're doing it, and whether or not that's something that would be valuable in their community.
Jill, how is it funded?
Well, we're funded through many different sources, not just the clinic, but also the health department as a whole. And so every time we see, like in the clinic, for example, every time we see a patient, we charge for those services just like you would at any clinic. So we would bill Medicare, Medicaid, insurances. If you're uninsured, you also receive a bill, but depending on your insurance or depending on your income, you may, if you're below 100% of poverty, you only pay the minimum fee for your medical care or your dental care or other ancillary services. And then up to 200% of poverty, there's a graduated scale above that. So we generate fees or charges that we get reimbursement on from that point for patients who can pay. And then the federal government kicks in the rest of that. But it's a balance because we don't get, if we see more patients that are uninsured, we don't get more money. So we have to work within the means that we have and be very efficient and effective with our services. On the environmental side, we have permitting fees, licensing fees. We register all the daycares, and there's a little bit of a charge that goes along with registering the daycare. Things like noise permits, things of that nature, we generate revenue that way as well.
Expand a little bit more on daycares because people ask that a lot. Do I need to be licensed in Sioux Falls in the state of South Dakota to have an in-home daycare?
In South Dakota, it is voluntary to be registered with the state. And then in Sioux Falls and a few other communities around the state, it is required to be registered. Not licensed as a family daycare, but registered. So in Sioux Falls, we register in-home family daycares. And that assures that we're doing background checks, getting some minimal assurances of safety and other things for the family daycare that are in those homes, and allows us to do inspections and make sure that we are doing the minimal amount, at least, of interfacing with that daycare to assure that those basic needs are met. But I always tell families, do your own homework. Make sure you're sure that you feel good about those family daycares of when your kids are going to those particular homes. So. And
if any of us have concerns, do we call the health
absolutely,
department?
Absolutely. We take concerns and complaints about family daycare on, it kind of ebbs and flows, the amount, and but we follow up on them right away and make sure that we are keeping, if there's anything that we find where a daycare has to receive, like maybe a citation, unfortunately, that's rare. But if they need to have a citation issued for something that's out of compliance, or they are somehow suspended or revoked, we make sure the families know that's happened. So.
All right, very good. Let's segue to the ambulance service. It's
Sure.
been talked about quite a bit at city council level and in the public and in the media with Paramedics Plus, the ambulance service that's been chosen by the city.
Absolutely.
So explain the oversight that the public health department has with the ambulance service and in your interaction with that contract.
Sure. Well, the City of Sioux Falls, the Sioux Falls Health Department is really charged with providing that quality oversight of the ambulance contract or the contract compliance of the agreement between Paramedics Plus and the City of Sioux Falls, but also in charge of quality assurance for the EMS system as a whole. And so we were the department that was a few years ago charged with, it was time to select a new ambulance provider. And so we were responsible for the RFP process, getting all those proposals in. What do those proposals need to look like to satisfy us that someone would be a responsible ambulance provider? in this community, and then pull a group of people together that could ultimately review all those proposals and make a recommendation to the REMSA board, which is our oversight board of citizens. 5 citizens in Sioux Falls make up the composition of that board. They would ultimately then make a recommendation to the city council, and then the city council would approve that agreement. That's what happened a couple years ago. And since then, Paramex Plus has been the provider in Sioux Falls. And they have a tremendous amount of complexity in that contract of elements that they have to be assuring us as a city that they're complying with, that they're providing the level of care that we expect, that what they said they would do in their proposal, and that they're actually doing what they said they would do. So we do a lot of quality assurance in our department in that area.
A lot of interaction with that, but let's talk about the process, because I think it changed here this fall, the process of making an ambulance call, because a lot of us as citizens think, I'm in trouble, I need an ambulance. But not all calls necessarily are ambulance, need an ambulance to come to them. And you talked about the emergency medical system and how all that works. So help us all understand when I need an ambulance, or when maybe the fire department's good enough or the police department's good enough.
Sure. Well, in very short time frame here, I'll do my best, because it's extremely, it's a large system that makes up a number of agencies. And so let's just take like a typical call. Someone calls into 911, and that's answered by Metro 911. That call taker is trained specifically and has protocols in place to identify what kind of an emergency or what kind of need do you have. And so based on a specific set of questions that they're required to ask, they then determine what priority of a call this is. Is it a priority 1, meaning a life-threatening emergency? Is it a priority 2, meaning a non-life-threatening emergency? Or is it a priority 3, meaning a non-emergency transport? And each of those are identified with a time that it's required that the ambulance respond to that 90% of the time. So that is set in place. So for example, priority 1, a life-threatening emergency, they need to be responding within 8 minutes and 59 seconds, 90% of the time. That's the way the contract was written, and it's the way many communities try and assure responsiveness of their ambulance provider. So those are as you can imagine, if it's called priority 1, it's the top priority. So all calls are really prioritized to make sure we're getting to those life-threatening emergencies. And then priority 2 and 3 are a little bit longer time frames, and those are kind of triaged, if you will, by between Metro 911, fire, and the ambulance service. So when that call goes out, the first thing that happens, if it's a priority 1, let's just stick with that one, the very first thing is police responds. They have AED equipment, they're trained in CPR, there's things they can do in first aid to immediately meet the needs of that life-threatening emergency. Fire then shows up. Their response time has to be within X number of minutes, and I want to say it's less than 6 minutes, 90% of the time, they have to respond. And so they get there, and there's a set of things they can do as well, because they all are trained to be EMTs at a minimum, along with being a firefighter. So they do a certain set of skills. Then the ambulance comes right after them with that P1, or that life-threatening emergency, and they have a set of skills that they then provide, get that patient in that truck as fast as they can, given the emergency, and get them to the hospital. And in the meantime, when they're getting them there, they're able to do a set of more advanced skills, advanced life support skills, that can assure that they're providing the care that's needed between the time where the moment that incident occurred and where it happened to when they get them to the hospital. How's that for
That's good. I appreciate that. That makes a lot of sense.
Sure.
For any of us to have to be in a position to call for help, it's a scary situation anyway. So I can appreciate where all of us as citizens could have a perception that I need an ambulance when, rightfully so, maybe you didn't. Maybe it's not an emergency. And so Metro Communications, as I'm understanding, plays a pretty critical role helping assess this.
Yes, they're a really critical role, because they manage all that resource for of the ambulances. So they've got it's called a Pulse software program. And so they're responsible to make sure that they're allocating, they're dispatching those resources. So they know where all the trucks are, all the ambulances at any given time during the day. And so what they did do to do performance improvement was say, you know what, it was about a year ago, we were having a lot of issue with, they were dispatching too many calls to what we call mutual aid. It just didn't seem like the right number. That should be a rare occurrence when you have to dispatch mutual aid, which means you might need assistance from an outside ambulance service outside of the city of Sioux Falls. And so we all said, we can do better. This is not good performance at this moment in time. There was something with the communication that just wasn't right. So they set to task looking at studying that. They had an idea of how they can improve it. So they did a pilot study for about 3 months. And sure enough, they developed a whole resource depletion protocol that has really fixed that problem. And so it has taken them from a more manual system of notifying the ambulances when there's another call that's come in, if they're all kind of en route, for example, or maybe someone's at the hospital just finishing up with a patient. It notifies them automatically instead of it being a manual process that, hey, we got another call, get back in your truck and get going and get moving. And it's really helped the process a lot. It has really decreased the amount of times we're calling for outside assistance, or the Metro is for more resources. So.
And the current ambulance system has a different response. Rather than staying in static places, they roam the city and are ready to be called.
Yes.
That's the difference between Rural Metro and Paramedics Plus.
Yeah, they do a number of things that are very different than the prior ambulance company did. And that is one where, instead of having stations around the city, they have one station, but when you get ready, you start your day as a paramedic and EMT and you are, getting in your truck and you're positioned, and they use historical data to decide where to place them today. And then by hour of day, they look at how many resources do we need out in the field based on historical number of calls for times of day. And so they're able to make sure they staff the number of trucks they need and where they need them for maximum performance. So they're already shaving off, I think they kind of estimated about a minute of time just by not being in those stations like it used to be, and rather in the trucks ready to go. They were already in the truck ready to go rather than having to do that when the call came in.
So if I see them parked, say in a strategic parking lot somewhere in the city, they're on call and ready to go when they get a call.
Yeah, but guess what? They are pretty much, I don't see as much of that anymore now either. I think the more the city grows and the more they get accustomed to understanding what the needs are to be able to be responsive, they're moving all the time. They're always out moving, and I doubt there's very much time any paramedic or EMT is sitting in the truck for very long. I think they're working, they're usually busy. And so I know that was something that they would talk about with the transition, was not maybe liking the idea of sitting in a truck, but I bet they're working quite a bit of the day.
Yeah, you don't see them
very
often. Once in a while you do. You see
once
them
in a while.
staging from somewhere in the city, ready to go.
Yep, that's right.
Jill, how many mutual aid agreements do we have?
Sure. Well, first off, the city doesn't hold those mutual aid agreements. In the contract with the City of Sioux Falls and Paramedics Plus, they're required in good faith to negotiate. It says a mutual aid agreement, or it doesn't necessarily say how many. It just says mutual aid agreements. And so I know they have 2 mutual aid agreements with right outside of the city limits, a couple of rural ambulance services. And so they've satisfied the terms of their agreement. However, Metro Communications can require or ask for mutual aid at any time of anyone. And so what those 2 mutual aid agreements are that Paramedics Plus has are really for them to just know they've got partners that they can call on and work with if they need to. But Metro Communications can reach out at any time to any other ambulance service if they think mutual aid is necessary.
All right, thank you.
You bet.
We're going to take a break and talk more about how the Public Health Department is protecting you and the environment around Sioux Falls. And if you want to know more about the ambulance service or REMSA, you can find out at siouxfalls.org. Click on Departments and go under Public Health. We'll be right back.
Hi, I'm Dr. Wickersham with Falls Community Health, here to talk about staying cool in the summer heat. When in the sun, wear light-colored clothing and a wide-brimmed hat. Spend time in the shade when able. Drink water every 15 minutes, even if you are not thirsty. And monitor those around you for symptoms of heat exhaustion, such as dizziness, headache, muscle cramps, nausea, and vomiting. If you experience any of these symptoms, please contact a physician immediately.
And we're back to Sioux Falls Directions, where we have conversations with the 12 directors of the City of Sioux Falls so you can get to know more about what they do. Jill Franken is here, our Director of Public Health, and you can find out more about Jill and her department at siouxfalls.org. So Jill, during this season, the mosquitoes are out. We've had some rain.
Yes.
Everybody's concerned about Zika virus and mosquito-borne type of illnesses. So what are you doing about that?
Well, in Sioux Falls, actually South Dakota is a great mosquito, mosquitoes love South Dakota, and the kind of mosquito that carries West Nile virus really loves South Dakota. So we have a very robust mosquito control program in Sioux Falls for that reason. And also it's a great quality of life, advantage for Sioux Falls and for residents to be able to go out in a night and not be barraged with mosquitoes. So we have a significant program where we do both trying to kill the larvae, so that we don't have to do as much spraying, but knowing we can't catch all the larvae. And so then we do have a spray program as well. And has been started, and we'll be seeing, some sprays throughout the summer.
What should we do around the house to avoid making breeding grounds for mosquitoes? You
really look for any area where you have standing water. So even in your flower pots, that's a great place for mosquitoes to, love having their larvae hatch, and lots of mosquitoes can proliferate just in a simple little pot, the little thing that goes at the bottom of your pot and collects the water. So anything, tires, any kind of, bird baths are really terrible for mosquitoes. Any standing water. If you have a nice water feature that the water's constantly flowing, mosquitoes wouldn't like that area. And so we really encourage people to get rid of any of that standing water as possible, or larvicide for that, so that they can protect all of us as much as possible.
It sounds like it doesn't take much standing water at all.
It really doesn't.
To make a breeding ground, huh?
No, it really doesn't. And so we do surveillance all around the city for all of those areas that might have standing water. And we have mosquito traps all around the city for looking for the presence of not only numbers of mosquitoes, but the types of mosquitoes, and then any of those mosquitoes that are starting to carry the disease or the virus, West Nile. And then we also have a few traps for Zika. You mentioned Zika. And while we have not seen evidence of that mosquito in South Dakota yet, we are doing some surveillance to be on the lookout for it.
And it's fascinating because you have staff that actually, under a microscope from these traps, are counting and looking at mosquitoes.
Yes, absolutely. Yeah, they're very expert in that area, and we have we have a summer team that does the spraying and the larviciding and the collecting the traps and doing all the work that you just mentioned. Yeah.
A lot of us live in terror of ticks because
Yes.
we hear so much about ticks and the disease that comes with that. Big concern for us around here?
Well, the concern is if you're camping in areas where, ticks that carry Lyme disease and others, Minnesota has a much more higher prevalence of the type of tick that would carry more diseases. And so if you like to camp there or have a summer cabin in those areas, you might want to be really thinking about, how to protect yourself, but always protect yourself from ticks as much as possible, and mosquitoes. So, bug repellent and clothing to keep yourself covered and protect yourself as much as possible, and then be just inspecting yourself when you're out camping, checking over for things, because ticks, even if it's not a tick that carries a disease, if you're not taking care of that area, getting that tick properly removed, there's just little things like a little skin, you can get an infection, we call it cellulitis, that can occur from those types of encounters with ticks too, so you got to be on the lookout for that.
You do a lot of food inspection. Obviously, you're going to come around to our picnics at the parks and take a look at our food. But and what are some tips to stay safe and healthy with food out during the summertime?
Absolutely. We do inspect all the temporary food stands. So all of our great events that are happening all summer long, our inspectors are busy inspecting all of those and making sure that when you go to all the things that are happening around Sioux Falls, that you're eating food that's been it's as safe as possible. Let's just put it that way. And so as far as your own prep, that the important things to remember is making sure your hands are clean when you're handling food, making sure that hot foods are staying hot, and cold foods are staying cold. When you have that all-day picnic and you got that potato salad sitting out, or other things that are, really have a tendency to cause problems. So making sure you're putting things on ice, keeping it cold, putting it away in the cooler when you're not using it or eating it, and keeping things hot when they need to be kept hot. So
makes sense.
Yeah.
Finally, before we go here, Live Well Initiative has been very big around Sioux Falls, and let's talk about smoking.
Sure.
One of the biggest aspects of this has been your response to where you can smoke. Obviously, we're encouraging people to quit smoking, but where you can openly smoke in the city of Sioux Falls.
So, we had a great partnership with the city council in getting the most recent tobacco policy approved. And one of an important element of that is tobacco-free youth recreation. And so any place where youth are recreating in our city, tobacco cannot be used. And so that was a policy of the Parks Department prior, but now it's an ordinance, and it's in that language. So, and youth activities are intended to be or defined as any activity for age 18 or younger that's occurring anywhere in the city. And so that is a new ordinance. And then also, we now have some smoking policies around where you can smoke on city property as well. So you cannot. You have to be smoke-free within 25 feet of any city building. So like the building we're in right now, that building, City Hall, Carnegie Town Hall, those types of the new city administration building, we'll have to maintain a 25-foot distance to be able to smoke. Any of the permitted activities in our parks will have to be smoke-free unless they have a special designation that they have to ask for to have a designated area to allow people to use to smoke. All of our properties that are managed by a third party have to be smoke-free unless they want to have a designated area, to be able to use to smoke in, and they have to have that approved by the Parks Department. The Premier Center, our event center, there's a road that goes around that entire event center. And once you pass across that road, then there's no smoking beyond that as well. So, and then lastly, but very importantly as well, our golf courses. There's no tobacco or no smoking except for in the parking lots of our golf courses or during the course of play. So once you've left that number 1 tee and before the 9th green and then 10th tee, 18th green, you can smoke out on in the park area of the golf course, but you can't smoke around the clubhouse or driving range, putting greens, etc.
Okay.
Yeah.
It's good to know. All listed on the website so we can keep track of that?
Sure is. This was a great public health ordinance that was put in place, and I really have to thank the City Council for all their work on that.
All right.
Yeah.
Well, thank you for your time today, too.
You bet. Thank
Lots
you.
to talk about in the Public Health Department.
Absolutely.
All right. And if you'd like to know more about the Public Health Department and what Jill and her crew does there, you can find it at siouxfalls.org, and also all the phone numbers that you need, not only to connect with the Public Health Department, but Jill was talking about code issues and things maybe that you see in your neighborhood, because we rely on you to be the eyes and ears to help keep our community safe as well too. So there's ways that you can report issues or find out more about issues on our website right on the front page at siouxfalls.org. I'm Reed Holson. See you next time when we talk about Sioux Falls Directions.